Hi, I'm Keri Atchley. I live in Jacksonville, Florida, and this is my story. The pain really became exasperated with the horseback riding accident in high school, and literally took me 2 years to be able to sit for a movie. It hurt so bad. And then that kind of went away, and then it came back full force, and it just never went away. Doing so much research for having back pain for so long and for it to progressively get worse, I couldn't go on anymore in that kind of pain. Something had to be done, and I was pretty convinced that it was gonna be surgery.
During high school, there was a little bit of a disconnect between us. I personally had to grow up a little earlier and kind of do things myself because her back pain was just so much that the only thing that relieved it was like laying in bed all day.
We've talked to countless doctors. We've been down a few paths in search of that solution, and we didn't find one until we ended up here in Jacksonville at UF Health.
Dr. Tabanapour, the younger brother, is the first surgeon I met. And at that appointment, he said that he was gonna have his brother most likely do the surgery with him. I didn't know if that was normal practice, and I had seen some articles written about them, and I knew that they had great bedside manner and that they cared about their patients.
Keri, when I first met her, was a wonderfully sweet, nice person. She had a previous surgery called an SI fusion that was done in an outside hospital in 2020. That did not help her.
Miss Ashley's source of pain was in her lower back. Her discs were pinching her nerves and causing pain.
Think of discs as shock absorbers. Same thing as the cushion of your bottom of your sole. When you don't have it, it can constantly then feel like bone on bone, and that's what Keri had. She had bone on bone pain. Because of that, it has abnormal motion. What you really ultimately need is called a fusion.
The procedure that she undertook, we commonly perform. It's minimally invasive and allows the patients to recover and heal much faster than the traditional surgical approaches.
I felt immediately better. Immediately after surgery. But I could just simply do something that slight to set my back pain into shooting. It was just the slightest thing, and I'm like, this is not hurting at all.
She was just out of bed, like walking literally the day after the surgery. The pain from the surgery didn't even compare to her general back pain beforehand.
It's so nice to be able to do things and enjoy it and not just be ready to get home so I can lay down and get out of pain.
We're just grateful to be able to go for a walk around the neighborhood, go shopping up the street in the village, throw the ball for the dog, who always wants to chase the ball. But just being able to do simple things like that is really nice.
I'm really happy that we have you back and you're able to be there now without pain and just be more in our lives and not have pain build that wall in between us.
I hope that there are going to be more and more success stories like mine, because I would do it all over in a heartbeat. My life is so much better physically, mentally, and getting energy back, feeling an improvement every day is just, it's incredible. It is incredible. And I would highly recommend make a phone call. It's not going to hurt to make a phone call. And it starts there. And trust the process. It's worth it.